Good evening, Congressman Bishop. I want to thank you for taking the time to meet with us and hearing both sides of this issue.
And your town, sir?
Hopog, Smithtown, but our local is in Patchogue, Brookhaven. My question to you, Congressman. Will the health care reform bill, H.R. 3200, result
It's difficult to hear you, sir. I'm sorry. Try that again.
Will the health care reform bill, H.R. 3200, result in the loss of private health insurance, especially one that is collectively bargained for by the union?
Michael, if I could ask you, the last part of your question, you asked if H.R. 3200 would result in the loss of private insurance, and then you said something else.
Especially one that is collectively bargained for by the union.
Especially one that is collectively bargained. Okay, thank you. I'm sorry, I'm having a hard time hearing. Thank you very much. Okay, short answer, no, will not. Here is, if employers are providing their employees with coverage, that employer only has three choices. One is to maintain the existing coverage, which in the case of an employer bargaining with a collective bargaining unit, they have a legally binding contract that requires them to maintain that coverage. That will remain in full force and effect. The second choice that the employer has is if they have coverage that they're providing with one private provider and they decide that they don't like that private provider, then they can pick a separate private provider, a new one, or private insurer, I should say. And in the case of a union, the selection of that new private insurer would have to be collectively bargained with the union. The third choice that the employer has, and this really exists primarily in non-unionized settings, is that the employer could say, you know what, I'm not going to provide my employees with health care anymore. Now, if they make that choice, they would be required to pay a tax of 8% of their payroll, and their employees would then go into this so-called health insurance exchange, where there would be several options available to those workers, and then those workers pick whatever option they want. So presumably, if we ever get there, there will be an option or several options from Aetna. I'll try to finish. The health insurance exchange will have several choices.
Sir?
All but one of which will be private policies, one of which, if we ever get there, will be the public policy. The employee picks whichever plan he or she wants. So, Michael, I hope that's answered your question. Thank you.
Okay.